Welcome everyone to the Global Social Service Workforce Alliance webinar series, which is brought to you by the Alliance through funding from the United States President's Emergency Plan for AIDS Relief, PEPFAR, and the United States Agency for International Development. This For Children project is implemented by the consortium of organizations led by Catholic Relief Services. I'm Natia Patschaladze, the Senior Technical Advisor of the Global Social Service Workforce Alliance, and I'm based in Tbilisi, Georgia. Today's session is the second live broadcast of the 24th webinar dedicated to the new resources to strengthening case management approaches. This webinar was originally held on February 13th, and due to the high demand, it is rebroadcasted live again. Next slide, please. During 1 hour allocated for the webinar, we will provide a brief summary of the Alliance Case Management Interest Group and Subgroups work. And then Kelly Bunkers, the co-chair of the subgroup, will talk about the document on core concepts and principles of effective case management approaches for social service workforce developed by the subgroup. Then Severin Chavrel, co-chair of another subgroup, will talk about the process of developing case management tools and resources compendium, and we'll talk also about its contents. We will make sure to allocate enough time for your questions and comments. We will also briefly discuss next steps of the work of the case management interest group. You will have a chance to participate in a poll and share your thoughts about the most important topics the Alliance Case Management Interest Group can work on in the future. Before we move further to the topic of our discussion, I would like to thank co-chairs of the Case Management Interest Group subgroups, Kelly Bunkers and Khadija Karama from Concepts and Principles subgroup, and Severin Chavrel and Nathaniel Awapila from Tools and Resources subgroup. If not their dedication and hard work, we wouldn't be where we are now, presenting to you these new resources today. I also would like to express our appreciation of the consultants who have supported this work at the initial stages and throughout the process. Also the review group members and all members of the Case Management Interest Group and subgroups for their continuous support. During the process of developing the new resources presented today, we have been collaborating with many organizations, and I would like to express appreciation to all of them for their support. Particularly, I would like to highlight our close work with Case Management Task Force and of the Alliance for Child Protection in Humanitarian Actions. Number of resources developed by this group are already included in the new compendium, while several documents being currently developed by the task force will be shared with the Global Social Service Workforce Alliance when ready. Today, I also would like to thank Amy Bass, who is the director of the Global Social Service Workforce Alliance, because she's the one who will ensure the smooth flow of our session, and she's been also supporting with the development of these resources and the webinar itself. So now let me move to my part of the presentation. I will not take much of your time today for talking about the Global Social Service Workforce Alliance. As many of you might know, our aim is to convene and connect, advance knowledge, and advocate for strengthening social service workforce globally. The Alliance was launched in 2013 and now is uniting over 1,700 members from 124 countries. Next slide, please. The Alliance runs two interest groups currently, one of them being Case Management Interest Group. The purpose of the interest groups is to convene experts into task-focused and results-oriented groups to address the area of specific interest to the Alliance membership. In this particular case, it's case management. Gather and consolidate information on a specific topic, develop products intended to advance knowledge, discussion, and solutions related to a specific topic. The Case Management Interest Group was established about 1 year ago as a result of increased interest of the members of the Alliance in this topic. The interest group has two subgroups. Concepts and Principles subgroup aimed to develop a document which would build on other resources and provide a concise description of the concepts of case management, applicable in development and humanitarian settings by professional and paraprofessional social service workforce. Another subgroup, Tools and Resources subgroup, has reviewed extensive case management tools and resources to assemble a collection of the documents useful to the members of the Alliance and other interested stakeholders. We see the Compendium as a living document and aim to continue collecting and screening additional resources in order to enrich the Compendium. And you are all asked and welcome to share with us these resources if you have them available. Case Management Interest Group unites about 60 members currently, and we invite you to join the interest group. If you are not yet a member of the Alliance, join the Alliance first. So I will stop here and we'll invite Kelly Bunkers, the co-chair of the Case Management Concepts and Principles subgroup, to present the core concepts and principles document. Next slide, please. Thank you. Kelly is a technical director at the 4Children Project and the senior partner at the Maestral International. She's an advisor for the Better Care Network, Phase 2 Action Initiative, and Global Health Promise. Kelly is joining today from Kenya. Please, Kelly, the floor is yours.
Thank you. Thank you, Natia, and good morning or good afternoon to all of you who are joining, depending on where in the world you are joining us. I'm Kelly Bunkers, and I am delighted to be presenting today and want to extend my thanks to the Alliance for giving me this opportunity to provide some background on the Case Management Concepts and Principles document. Next slide, please. Speaking of the document, the link for this document that I'll be presenting can be found on this slide. Next slide, please. So, this document, as Natia just described, was developed by the subgroup for concepts and principles, which is part of the larger case management interest group. And I think it's fair to say that in recent years, there has been great interest from many different sectors, but particularly the social service sector, in case management. And a lot of materials have been developed, and we really saw this as an opportunity to through the subgroup, to bring and consult with members of different organizations, government, managers of development programs, or social service practitioners, as well as academics located in various parts of the world, to come together and create a document that really did lay out a very clear understanding of what the concepts and principles behind case management through the lens of the social service workforce. So our primary aim was to develop a guide that was easy to read and could be used as an easy, accessible reference document by different members or cadres of the social service workforce, as well as those other professionals that are engaged in case management or social service work. And we really wanted to provide sort of a foundational document that could be used to support the social service workforce responsible for implementing all or parts of a case management process. So one thing that's important is this paper is really meant to be a starting point and can be adapted and contextualized to reflect the needs and situations of whomever is using it. Next slide, please. So I think a great starting point, of course, is to define case management. And so as you see on the slide here, we define it as a process that's practiced by social service workers to really support or guide the delivery of an appropriate set of social services and support. We really targeted case management, as I said, through the lens of the social service workforce and targeting vulnerable children and families, as well as other populations in need. And I think what was so interesting and what is hopefully reflected in this document is that we had members who were participating in the development of this document from various sectors. So we had some from the humanitarian sector and some from development. We had some who worked with the elderly and others who worked with children. So it really does, we really tried to make sure that it was applicable to various contexts and various populations. Next slide, please. So this is a graphic, an illustration of sort of the case management process and the different steps involved. And I won't go into these in depth, but because the document does, but just to begin with the identification. And I think identification, there are lots of ways that this can happen. They can be identified through targeting, they can self-identify. I think we have instances where, for example, community-based child protection committees might be responsible for identification, etc. But that's a key step that begins the process. And from there, it's an initial screening, sort of based on what the strengths and needs identified are. That is sort of a good way to understand it, is really that first filter to determine if, in fact, a full case management process needs to move forward, or in some cases, as many of us who work in this field know, the situation can sometimes be resolved through referral or another measure without going into the full case management process. And so that's number 3 when that happens, no action required. Excuse me. And then step 4 is to assess. And as we know, this is a critical step in the case management process, where we look at the strengths and the needs of the client, whether that be a child or a family or an elderly person, but really do a thorough assessment. And from there, that informs the development of step 5, which is a case plan. Step 6 is implementation of the case plan. And I might add here that in step 6, implementation of the case plan, a critical part of that is also referrals, because we know that some organizations aren't providing every service that is required. And so it's absolutely necessary to understand who other service providers are, so that we can ensure that we do meet the needs identified in that case plan through the delivery of services from ourselves or others. And then 7 is review. That's the time where we sort of take stock of where we are, using the case plan as our roadmap, and determine what have the goals been achieved, have the actions been fulfilled, and whether or not we need to either return to step 4 and reassess, or determine that the case is ready to be closed because we have successfully achieved what we set out to do in the case plan. I think one thing that's really important is that throughout all these steps of the case management process, documentation, whether written or electronic, is critical. And the compendium that my colleague Severine will be presenting next will provide an overview of the many tools, standard operating procedures, and training curricula that have been identified and included in the compendium for the different steps of the case management process. And many of these documents include valuable information, for example, around data collection and storage or child safeguarding throughout the process. Next slide, please. So I think the principles of case management, for those of you listening in that are involved in social work, I think these principles will seem very familiar to you. These are obviously grounded in good social work as well as human rights instruments. I think it's important to note here that the best interest of the child, for example, might not be listed on the slide, but it is absolutely a critical principle that is included in the case management process. And another thing I think that we have seen recently is a growing recognition of the importance of actively engaging and being intentional about that engagement of the children, adolescents, and adults that we do serve through the case management package. And so some of these sort of the collaboration and partnership, those reflect this idea that the case management should really take on an empowering approach wherein clients are actively engaged in identifying their own strengths and resources, developing their case plan, etc. So I think this is an exciting moment that we have seen sort of a shift in the sector, and this is definitely captured and built upon the principles that we see here. Next slide. Thank you. So in developing this document, we really sort of thought about who is involved in case management. And as we know, those of us who have practiced case management, and coordination is absolutely key to a successful case management process, and coordination with the clients we are working with other service providers, with statutory bodies, etc. But within our own social service workforce, we like to reflect upon the definition that's used very often by the Alliance, and depending on the context where case management is being implemented, the social service workforce can include paid or unpaid workers, professionals or what we call paraprofessionals, as well as government or statutory, and those working in civil society. And as I mentioned earlier, members of community-based coordination mechanisms such as child protection committees. So it was really interesting as we developed this document to learn from those who were engaged in this process what it looks like in their own context and who has what role and responsibility. Another key point when we're working with the clients that we do work with is the role of allied workers. And those are ones who may not be directly responsible for certain steps of the case management process, but they are part of it, and we might call upon them, or they might have a specific role during one of the steps, one or more of the steps. And those are what we call allied workers, and those can include, as you see on the screen, police, teachers, doctors, magistrates, religious leaders, etc. And again, just to reiterate that a theme throughout is that for successful case management, coordination really is key. Next slide, please. And so finally, one of the things that you will find in this document is we went through and we thought about what are resources that are required to successfully implement a case management process. And we sort of divided this between what's really critical. And if you're thinking about this, if you're a program or you're a government and you want to implement a case management approach in your work, what do you need? And so absolutely standard operating procedures and tools. And as I mentioned, we'll hear more about that when Severine presents next. We need trained workers, and those workers can come from, as I said, they can be professional or paraprofessional, they can be volunteers, etc. But they need to have an appropriate, ideally standardized training, especially around this case management approach and ways to work with the clients that we're serving. There needs to be a place for safe storage that is confidential for all of the documentation, upholding that principle of confidentiality. In many instances, they need access to transport. I know in contexts where I work, in villages, that houses can be set in rural areas and transportation is needed. The same might be true in urban areas where cars or public transport, there needs to be access. A telephone, I think it was interesting to learn more and more how the use of cell phones, WhatsApp groups, etc., are supporting some of the workforce as they work together, but also necessary in terms of reaching clients. And then a place to hold meetings. And this is especially important in terms of supervision, case conferences, etc. And then other considerations, maybe not absolutely critical, but definitely for consideration, would be appropriate documentation, some kind of an emergency fund for clients that might be in crisis and need some kind of an expense paid, or some kind of contribution of clothing, school supplies, etc. And then, of course, an incentive scheme or motivation. We know that caseworkers often work long hours and have incredible caseloads that they carry. And so some kind of motivational approach that really keeps them engaged and content with their work. Next slide, please. Okay, thank you.
Wonderful. Thank you so much, Kelly, for such an interesting and concise presentation of the document, and also for highlighting the aspects which were of a particular interest for the participants of the previous webinar. Thank you very much. I would like to ask the participants to note their questions and start typing them in after the second presentation in the chat window, which will be visible for everyone. And now I would like to ask Kelly, ask Severin, who is the co-chair of the second subgroup, the Tools and Resources subgroup, to guide us through the process of developing the compendium and the documents which are included in the compendium. Severin is a child protection and welfare systems technical advisor at the 4Children Project and a senior associate at the Maestral International. She works in the field of child protection, care and support, and system strengthening in emergency and development settings. And this time, Severin is joining us from the United States. Severin, the floor is yours now. If you want to unmute yourself, maybe that's the case. We cannot hear you yet. Amy, could you please help us in unmuting the presenter? Okay, while we're trying to unmute our next presenter, let me tell you something which I wanted to share with you after this presentation, but not to waste our time. I would like to tell you that after the presentations, we will offer you to participate in a poll where we will be asking you numbers of questions in order to help us to decide on the next steps of the work of the case management interest group of the Global Social Service Workforce Alliance. There are some aspects of the work that we have defined as very important, and we have heard these topics as being interesting in many different discussions. And so your answers to the poll questions will help us will guide us in our next steps and in making decisions for the future. And now let me pause and see if we have Severin online, and if we can hear her voice. Severin?
Natia, this is Kelly. Severin is logging back in to see if that helps. So thank you, everybody, for your patience.
Maybe I could continue with the next slide, Amy, and Severin will continue.
Hi, everyone. Can you hear me?
Great, yes.
Sorry, I was muted and could not unmute myself and had to log out and log back in. But I am here, so hello everyone. For many thanks, Natia, for the introduction and for helping me out while I was figuring out the unmute system. And then many thanks, Kelly, for the really interesting presentation on the core concept and principles document. I think it really is a key document and is extremely helpful for our sector and will frame the discussion that I'm going to cover here on behalf of the other sub-interest group. Next slide, please. Thank you. So the other sub-interest group was focusing on case management tools and resources that would reflect the best practices that Kelly highlighted from the core concept and policy documents. And so what I'm going to cover is what was the aim of developing the compendium, the tools and resources available across the different settings, how to use these documents and the compendium, and the next steps to ensure that it is useful and can be enriched as we all work together. Next slide, please. So the real aim was to provide the most useful and relevant resources and tools to the wider membership of the Alliance. Especially, there was a strong focus that practitioners would be able to have very practical, user-friendly tools and guidance that would reflect the concept and principles being developed by the other sub-interest group. Next slide. So the subgroup discussed quite a bit of what was the best way forward. Initially, there were discussion of whether we should be developing tools or we should be looking at existing tools. We all agreed that there was already a lot of guidance, a lot of training curriculum, a lot of forms that and other job aids that already existed, and that we shouldn't replicate what was already existing, but really build and be able to share in a concise and user-friendly way tools, resources, guidance that could help the sector. So we developed, with the support of Beth Bradford, who initially supported this sub-interest group, a framework to assess and recommend case management resources and tools to include in the compendium. And again, it was really looking at ensuring that it presented the core principles and concepts that we were all developing together, as well as looking at who the audience is, making sure that it was technical, but also very user-friendly and practical. And also that it reflected the different type of settings that we were looking at. So there was an extensive effort to collect documents within our group, within the broader case management interest group, within the Global Alliance overall, and through our respective networks. And then a few members of our sub-interest group were very kind to volunteer extensive time to review using the framework, the assessment framework, to screen and assess the tools and resource. We mainly focus on tools that were developed between 2009 and 2017, and we ended up reviewing 60 documents overall. Then the collection of the most useful resources were identified, discussed with the group, the sub-interest group, and 25 documents were put together in the compendium. This is the first edition, so it's not exhaustive. It's a living document, and it can be found, next slide, on the Global Alliance website at this link. And you can see on the left how it's organized. It's organized over 4 categories: core concept and principles, tools and forms, standard operating procedures, and training materials, which I'll go in more detail later. Next slide, please. So in regards of the documents available, we really made a intentional effort to ensure that it included documents and resources that were interagency at the global level, as well as documents that were regional and national at country level, but also always keeping in mind of whether these documents had global applicability. We also really made an effort to represent practice from the humanitarian and development perspective, and as Natia mentioned, had conversation and included the documents with the Global Alliance for Child Protection and Humanitarian Action. We really wanted to target a broad range of audiences of various workforce. As Kelly mentioned, we were really looking at documents that would help, whether it's government social workers, or it is paraprofessionals, or community volunteers, etc., and that it would adapt and be helpful for NGOs, government, UN agencies, academic institutions, professional associations, and others who support the work of the strengthening the social service workforce. As I've mentioned before, there was a real focus of ensuring that it was useful for a practitioner and really concrete practical guidance. It's, again, not intended to be an exhaustive list of all available tools. Already since the last webinar we had in February, there's a few documents that we have received and that we're excited to be able to review and include in the second edition. We know of a few documents from the Global Alliance for Child Protection and Humanitarian Action, such as the Quality Framework and training for coaching and mentoring, that are hopefully being finalized very soon and will be able to be included in this compendium, which we're really excited about. Next slide, please. So the first edition was released last month during the first webinar. We obtained permission for inclusion of each resources included in the compendium. As I've mentioned previously, it's organized in the following categories. So there's guidance around core concept and principles. So there's 16 documents that provide guidance on core concept and principles. There's 11 documents that provides really clear standard operating procedures for each steps of the case management process, as Kelly has discussed and presented previously. There are 13 documents that have tools and forms. So these include documentation forms that reflect the different steps of the case management, as well as other forms, for example, case conferencing, etc. It also includes job aids. And some documents have some really interesting job aids that I would recommend for if you're interested to look at, including around caseload management, case conferencing, supportive supervision, record keeping, and looking at data protection, protocols, etc. So those are all included in that section on tools and forms. I just want to highlight one area that we did not include for now, but we discussed this at length during our discussion within the group, was information management system. And we all agreed that it would be very helpful to review and to include in the second stage different information management system, but that was not the scope of this work, and hopefully maybe that's something, if the sector is interested, could be done in the second stage. The last category is training materials. There's 6 currently training curriculum. Not as many as we wish, and we really hope that we're able to collect more, and many of you can share what you've been using, what's been helpful, and we can provide further guidance and resources around that topic. Some resources, as you all know, included a lot of these different categories. So many included the guidance on core concept and SOPs, tools, and forms all in one document. So in that case, that document appears in all those relevant categories. Next slide. So again, this is the first edition, and it's a living document. We really would like for it to be continued, that there's continued improvement of the compendium, that it is used as much as possible, and that we can get feedback on the existing resources and tools and how these are being used and adapted, which one are the most useful and how. We're also hoping that additional relevant documents that are either already existing or as they come available, such as the quality framework or the mentoring and coaching training that I mentioned from the Global Alliance for Child Protection and Humanitarian Action, that we can include those as we get along, as we move to the second edition. And just general feedback on how the compendium can be further made relevant and applicable across different contexts. Next slide, please. So we're hoping as well that by doing this exercise that it's really useful for the sector, the practitioners, but also it can help us as a sector to identify gaps and areas where additional guidance might be required. So, for example, is there a need to review information management system that support case management, or is that done already? Or also, are there tools and resources for specific areas that maybe need to be developed by the Alliance with others to address gaps that we are identifying? I think that's it. Thank you very much for your time, and thank you to the Global Alliance for supporting this fantastic effort that's really needed.
Severin, thank you so much for this very interesting presentation of the compendium. I'm sure that it will make it even more popular and widely used. And now I would like to invite the participants of the webinar to type in their questions in the chat window so that I could pose them to the presenters. But meanwhile, I would like to tell you that this is a topic of a major interest, and often we do get many more questions that we are able to answer during the webinar. And because time may not allow us to answer all your questions today, and we were not able to answer all the questions asked during the previous webinar, we are committing ourselves to having a question and answer board on our website under the Case Management Interest Group window, and the members of the Global Social Service Workforce Alliance and the members of the Case Management Interest Group will be able to view our answers to the questions that we will not be able to answer during the webinar on the website. So if you are not yet the member of the Case Management Interest Group, if you are not yet the member of the Alliance and would like to see answers to some unanswered questions that we might have today, please register and you will be able to see this questions and answers board. Now let me start by reading a few questions which are already asked in the chat window. And the first one is, what are the case management standards that are available so far, is the question asked by the participant.
Sorry, can you repeat that question?
Yeah, the question is, what are the case management standards that are available so far? Severin, would you like to take it?
Or Kelly, would that work with the core principles?
I think so. Yes, I was just going to say. So I think that it aligns with the standards. Definitely are informed by principles, and I think that several of the documents that I think we used as reference documents and that are also included. I think that they talk about, and I'm just trying to think if we had specific documents about case management standards. I'm not, I'm not quite sure. I think that, can we come back to that one, Natia?
Yes, of course. I think we can come to this question later or in our written answers. Now let me see. The next question says, could you make reference to any specific tools that might help identification of client strengths, especially for highly vulnerable children? So reference to any specific tools that might help in identification of specifically vulnerable children, highly vulnerable children.
Sure, we can talk about that. I think that as For Children, for example, is working on developing a global case management package specifically targeting children made vulnerable or living with or affected by HIV. So, for example, we have tools that are designed to look at the strengths and protective factors that would keep children healthy, that would keep them safe, etc. While also, it doesn't mean you deny looking at some of the risks, but I think it's very intentional in terms of the assessment of looking at what those strengths are. And then as well, for example, in the template for the case plan, it would look at what some of those identified strengths are, how can they be built upon and leveraged, and then what are some of the needs in terms of services and support. So that's one example, and I'll let my colleague Severine also respond as she looked at and reviewed lots of different tools for the compendium. Sev?
Yes, so many documents are identifying, and there's many terms around eligibility or vulnerable criteria or risks, criteria, etc. The interagency guidance for case management in humanitarian action, in a humanitarian setting is really good in providing explanation of the vulnerability criteria, protective factors, and risks. And I know this is something that that group is working on further on defining. It also depends of your program, and I think that is so it and the context and who you're reaching, etc. I think so. It really needs to be contextualized within your program, but making sure that there's always safe referral pathways to ensure that any other criteria that are being identified with children that your program may not be able to respond, are responded through other services available within the community or more broadly, or the statutory system. In regards of standards, it really depends again and of the program. The one that comes to mind, and Colleen mentioned, thank you, Colleen, was the case management minimum standard for humanitarian settings. These are being currently revised, and they have a few standards. Well, they have quite a lot of standards, so that can be a good document to look at. And then I think, like within For Children, we've developed what we call benchmarks. And again, it's very linked to the type of program and the target of children and families that you're targeting, but there's specific benchmarks looking at what the program is trying to achieve with the families and the communities by supporting them and empowering them.
Thank you, Kelly. Thank you, Severine.
Natia, can I just one more thing about standards? Sorry, because I got a little. Yeah, I think where it's interesting, I think standards and sometimes principles are sort of used interchangeably. But another place where we have seen some standards that that might not be directly related or specifically targeting case management, but it involves specific standards that are necessary for the case management process, are around some of the workforce competencies, for example. And other standards that I've seen targeting the workforce and case management have to do, so for example, with knowledge, a standard for documentation and what's expected of that, a standard for ethical practice. And I think that's where something like the role of confidentiality would come in. So very much linked to the core principles. So I would think that you could take the core principles that we have highlighted in the document, and you could expand on them and use those to really frame the development of standards. And then from that, you could even look at, okay, and based on these standards, here are the competencies that we would like to see within the social service workforce engaged in different steps of the case management process.
And on that note, the quality framework that's being developed by the Child Protection, the Global Alliance for Child Protection and Humanitarian Action, is linked to those case management standards I was mentioning before, and really has like different tools to assess the quality of case management around those indicators, etc. So I think that will be really helpful for the sector as well. I'll stop there, sorry.
Thank you, Kelly. But let me ask the next question, which is also about the tools. And here UNICEF Mozambique is asking us specifically about screening tools that we are able to recommend, and if there are any included in the compendium. So screening tools that we can recommend.
Screening tools. Again, the interagency case management guidelines has some a really nice approach of looking at risk levels, which I think can really help in prioritizing your caseload. So I would recommend that document. The Namibia case management in a development setting used as well that risk level as a screening tool to prioritize cases, as well as other criteria. And I'm sure many others. I think the Malawi one as well has a rapid intake that does the screening. I'm happy to look at it further and respond directly to the person who's asking that question, if that's helpful.
Okay, thank you, Severine. And now let me move to the next question. And in her presentation, Kelly has mentioned that social service workforce includes members of the community-based coordination mechanisms, such as child protection committees. And that's how social service workforce is also defined by the Alliance. And the question says that these mechanisms are not necessarily only for coordination. It says that usually this kind of structures are also useful for identification, for making referrals, or sometimes in resource-trained environments, they are also for implementing certain interventions. And of course, we can only agree to this statement. These mechanisms are not only for coordination, but if there is anything that you wanted to add to this statement.
I think it's a great statement, and I would absolutely agree. And I think sometimes it's hard to put the sort of explanatory text into one PowerPoint slide. So community mechanisms such as a child protection committee, as I mentioned in one of the earlier slides, they can be absolutely instrumental in targeting, for example, and identification. Many of those committee members are very familiar with their community, and if they know what the risk factors are, et cetera, they can be absolutely critical to that identification process. I think we were just trying to really stress this idea, excuse me, that one of the most important parts of a case management process is that idea of coordination, that it does take many different actors, many different stakeholders involved at different steps and with different roles. And one great mechanism for that coordination, especially at community level in certain contexts, can be a child protection committee. So I agree with the comment, and I apologize if it wasn't clear in the presentation. Thanks.
And just to add, if it's okay, Natia, I think we've also seen community mechanism being able to help with follow-up, like keeping an eye on children and families that are being followed through the case management process, as well as providing or identifying community support that they need. So they're definitely instrumental at each step of the process.
Thank you. And we have one more very interesting question about the use of modern technologies. And it says that in Kenya, African Institute for Children's Studies have initiated WhatsApp group, Forum for African Children, that is contributing to case management. And so the author is asking about the risks that they should anticipate while using this WhatsApp group, and if there are any existing guidelines that they can borrow and build on.
I see that question is from Samuel. Samuel, it's great to have Kenya represented on the webinar. And I would say, I think this is perhaps something that would be really interesting to take offline and discuss, just to get a little bit more information about how exactly you are using the WhatsApp platform. Because what comes to mind, obviously, my first thought is around confidentiality and child safeguarding. But I'd like to learn more, and I would be more than happy to share already existing case management materials, some of which are actually developed here in Kenya. And again, as Severine mentioned, the Compendium also has quite a few. But I think this is something I'd be interested in learning more about. And given we're both in Kenya, I think we can take the opportunity to discuss if that's possible.
We have so many interesting questions, but I think I will only be able to read one more. And then again, as promised, we will make sure that unanswered questions will be answered on the website under the Case Management Interest Group webpage on the Alliance website. So the next question is about community implementing case management processes. It says that some think that case management is a set of professional social workers' processes which are not applicable for the community. So what can you tell us about the role of the community in providing case management?
Oh, I think that's an excellent question. And I think, again, it's sort of unpacking that term community. I think we have several examples, especially in the African context, of where case management is being rolled out by community-based volunteers. And so really trying to design SOPs, standard operating procedures, tools, and training to support that in a manner that can be understood and then utilized by what I would say are sometimes low literate populations, but really looking at how to engage not only the community volunteer, but other community mechanisms, such as those that I mentioned before. So I think we do have some good examples of that. I think, interestingly, more and more, and Severine can perhaps talk a little bit more about this, we are seeing that case management, it's being recognized that it can and does happen both at community level as well as the statutory level. And I think statutory level is particularly, when government and professional social workers are involved, it's often for those child protection cases that do need a statutory response. It can be for social protection programs, etc. But I think there is recognition recognition or a growing recognition that it can happen on both of those levels. But Sev, maybe you have something more to say.
I think you summarized it really well. I think it's about really identifying the roles and responsibility very clearly of what community volunteers can support within the case management, the training that they need, the competency that they need, and how it can link with a more formal statutory or not statutory case management system for more complex cases, whether we're talking about issues of violence, sexual violence, etc., etc. So it's really the clarifying that and ensuring that there are clear referral pathways from those different case management approaches.
Yes, thank you. But unfortunately, we have to finish with questions and answer session here because we only have few minutes left, and I would like to use these few minutes for discussing our next steps of the case management interest group. As I have already mentioned, we will make sure to answer these unanswered questions, and you also always can provide your feedback and send us your questions on the Alliance website. And if you, Amy, could show us the next slide. On the next slide, you will see my email address, and I will always also be happy to receive your questions and comments. And also, I would like to tell you that when opening the compendium on the Alliance website, you are invited to share your name and your contact information for Alliance staff to be able to follow up with you regarding the use of the compendium. This way, we are trying to figure out which are the interesting topics that and areas that we might need to add to the compendium, and we also want to learn about the use of the compendium. So in addition, as I've mentioned earlier, today we would like to share with you the poll with several questions. And Amy, if you could show us the questions. You are all invited to answer these questions in order to help us in deciding on the next steps of the case management interest group work. So the question you are asked is, what topic do you think is most important for Alliance case management interest group to work on? And you will be able to mark only one answer. And while you are doing that, I would also like to tell you that, as mentioned earlier, in order to be able to participate in the work of the Case Management Interest Group, you might want to register on the Global Social Service Workforce Alliance website. And after we complete this poll, we will show you a slide with the registration page. And after registering as a member of the Alliance, you will also be able to become a member of the Case Management Interest Group, but you will have to register for that as well. And again, you can always provide your feedback on the Alliance website, and we very much look forward to your feedback because, as it was already mentioned several times by Severin, myself, and Kelly, we really rely on your support in order to strengthen the compendium and continue our work in the areas which are of interest for all of you. And because we only have 2 minutes left, maybe it's already possible to summarize the answers of this quick poll. Amy, do we already have answers ready? Okay, wonderful. So as you can see, all of these areas seem to be quite interesting. So the most popular answer is the answer number 3. And it means that 1/3 of the participants of this webinar are interested in the aspects of multi-sectoral coordination needed for case management. However, as you can also see on this slide, the child protection information management systems, scoping and summarizing existing paper-based tools and information technologies is also the topic that many of you are interested in. And another popular answer is the topic of the competencies for different cadre of social service workforce working on carrying out case management. So these are 3 most popular answers, and they will certainly help us in our further thinking about the next steps of the interest group. And the members of the case management interest group will also receive follow-up survey where they will be able to share with us their thoughts and their ideas about the next steps of the Alliance work. So for the members of the interest group, please do respond to the survey questions as well when you receive those. So as I mentioned earlier on this slide, you do see the website of the Alliance and the way that you can register as a member of the Alliance and as a member of the interest group. Also, we would like to ask you in this remaining few minutes to share with us any announcements, any interesting events or resources that you think are relevant for the topic of our today's discussion. Maybe you could type them in the chat window, and then we will share them with the case management interest group members. And also, I would like to remind you that the recording of this webinar, as well as the notes of the webinar, will be posted on the Alliance website, and they also will be available on our YouTube channel. And also find summaries of all recordings of all 24 webinars that Alliance has offered during the time of its existence. So this is all that we're able to share with you during this 1 hour that we had today. And again, I would like to thank you, Severin and Kelly, for their great presentation and very interesting discussion. And I would like to thank Amy for her help today. And I would like to wish all of you the best of luck, and good evening, good night, and good day, depending on where are you joining us from. Goodbye and thank you.